Asbestos is a known carcinogen, and there's no safe level of exposure.
Mesothelioma is a miserable disease.
They must fight a truly global battle.
We want to demonstrate our enormous respect.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.
Keep me in your heart for a while.
Our next speaker, and again, as Linda pointed out, please take the time to read the biographies of everybody who's speakers, because we don't go into it, but Dr. Daniel Sterman, who's going to be talking to us about the care and treatment of mesothelioma patients, is a neighbor in Philadelphia. He's over at the University of Pennsylvania doing thoracic oncology. And with that, by way of introduction, Dr. Sterman. Thank you for coming.
Good morning, everybody, and thank you for having me here today. It is always for me a tremendous honor to speak to a group like this. I'm often asked to speak to groups of physicians and scientists, but to be at an audience, to be part of a conference and to speak to an audience that is made up of people who are fighting mesothelioma and other asbestos-related cancers, to be made up of caregivers and loved ones and family members and attorneys who are fighting for their clients on an everyday basis. For those victims of mesothelioma who can't be here today, it is such an honor to be here and to tell you just a little bit about what we're doing at the University of Pennsylvania. My goal in my very short period of time that I have in the next 15 minutes is not to give you an overview of everything that's going on in research in asbestos-related cancers. It's to give you a small glimpse into the hope that we and others are generating for the treatment of this disease. And I don't claim to have all the answers. I don't claim to have the cure, but I can guarantee you that we are working as hard as we can to get there. And with your help and with your efforts, we will get there someday. So I thought I'd show you a picture of my younger son, and with my picture of my younger son, give you some of the goals of the presentation that I have for the next 15 minutes. I'm going to explore some of the novel therapies that we are studying that we hope will shed some light on better treatments for cancers related to asbestos. And specifically today, I'm going to focus on the ways we at the University of Pennsylvania are trying to harness the body's immune system to help fight the cancer. By no means is this the only way to fight mesothelioma, lung cancer, and other cancers related to asbestos, but it is one way that we're hoping can help current therapies work better. I'm going to give you a quick overview of our recent and ongoing clinical trials at the University of Pennsylvania and where I hope we'll be going in the future. And I also want to talk to you in general about the directions of treatment for mesothelioma and asbestos-related cancers and where I think our treatments may meld with other treatments that are out there. So before I start, I want you to understand two basic concepts. And in any talk that anyone gives, there may be one or two slides that you actually have to pay attention to. This is one of them. So if you were going to fall asleep or go to the bathroom or get some coffee, stay for the next 20 seconds. Okay. So if you want to understand cancer immunotherapy, that is, harnessing the body's immune system to fight cancer, you have to understand two things. And you may have to suspend disbelief to do this. Number one, that tumors are different, that there are differences between cancer cells and normal cells that, at least in theory, should allow the immune system to recognize tumor cells as foreign, attack them, and kill them. Without that premise, immunotherapy doesn't work. And secondly, that the reason this doesn't happen all the time is that tumors have developed ways, mechanisms, to evade the immune system, to overwhelm the immune system, and therefore require a push, a stimulus, to allow the immune system to eliminate tumor cells. And it can do this. Now, if you look at the center, in the center on the green is a cancer cell. And what you see surrounding the cancer cell are all the aspects of the immune system that exist without any addition from me or stimulus from me that can attack and kill a cancer cell. The yellow triangles you see surrounding the cancer cell are what are called tumor antigens. These are proteins or substances on the surface of the cancer cell that can allow that cancer cell to be recognized and to be attacked and destroyed. We have all different cells in the immune system that we can somehow motivate to make this process more efficient. And we know from the medical literature that although rare, this process can happen, and it can happen spontaneously. So this is a slide from a colleague of mine, Dr. Bruce Robinson from Perth, Australia, who presented a case of a patient with mesothelioma who underwent a spontaneous regression. That is, the tumor was present, and even without treatment, the tumor melted away. Now, this patient's mesothelioma came back a year later, and the patient ultimately died. But the mechanism here is that the immune system, at least temporarily, was able to recognize the mesothelioma as foreign, to attack it, and to cause the tumor to regress. And if we can harness that on a routine basis, perpetuate that, give booster shots along the way, that we can turn mesothelioma, lung cancer, other asbestos-related cancers from a death sentence into a chronic disease that people can live with, like rheumatoid arthritis or high blood pressure. So why can't immune cells kill cancer? We have all the ingredients already within us for our immune system to attack, recognize, and destroy cancer. But cancers are smart. And they've developed ways to produce factors that suppress your immune system. These suppressing factors can come from the cancer cells themselves, from the supporting tissue within the cancer that isn't actually cancer, but it produces a lot of nasty chemicals that will block the immune system from working. And the immune system itself has checks and balances. Otherwise, we'd all have diseases that attack our own tissues like rheumatoid arthritis or lupus. And so therefore, within our immune system, we have systems that shut off our immune system. And these are normally protective for us, but in the setting of cancer are not very helpful. In our bloodstream, we have a number of different chemicals that do the same thing, which is to block the immune system from attacking cancer cells. And lastly, there are cells within the immune system that, as I mentioned, normally are helpful in preventing us from attacking our own tissues, but in the setting of cancer, we want to block or reverse. I am not the first person, nor is my group the first group, to try to harness the immune system to fight mesothelioma, lung cancer, and other asbestos-related cancers. This has been done for 20, 25 years, with some successes, mostly in small trials. But we at our institution in Philadelphia have been focusing on ways to block that immune suppression, that is, to release the ability of the immune system to help fight cancers. And we've been doing this through a number of different mechanisms. And I'm just going to give you a glimpse into some of the things that we've been doing and where we stand right now with our clinical trials. To understand the first group of trials I'm going to talk about, you have to understand what genes are and what human gene therapy means. So within all of our cells, we have a blueprint. This blueprint is called our genes, our chromosomes. And these are all made of DNA. So for those of you who are not familiar, the DNA basically contains everything about who we are and what we will become for the most part. So it tells a cell what to do and how to act and how long to live and when to die and when to grow and when to stop growing. But we have, for good and for bad, acquired the means over the past 20 years to be able to target cells with abnormal genes, to be able to replace those genes with a normal copy, or to put a new gene into a cell to alter the mechanism of the cell, to alter the way the cell functions. In diseases like cystic fibrosis, if you look at the panel on the right, we can know what the abnormal gene that causes this disease is. We can then target the cell that produces this abnormal gene, and we can put in a normal copy, and at least in theory, should be able to, in the future, cure the disease by replacing a mutant gene. It's very difficult to do. In cancer, we don't have to do that. In cancer, we can target a cancer cell and cause that cancer cell to die. And we can do that by changing the genetic makeup of the cell. This is not a new concept in mesothelioma. On the left-hand panel, you see a drawing by the famous medical artist Frank Netter, Dr. Frank Netter, who drew, I think, one of the most telling pictures of what pleural mesothelioma looks like, with the cancer surrounding the right lung and growing into the substance of the lung and encasing the lung, showing that this is not a spot tumor in one location, but a disease that involves the chest circumferentially. But what you also see with that little metal rod that he shows you is that there's a space, that pleural space. And one of the silver linings in mesothelioma, and there aren't many, is that that space allows you easy access as a physician or surgeon to get in and out, to administer experimental therapies, to monitor their effect of the patient, and to look for the benefits to that patient. And what we can do, if you look at the right panel, is to deliver genes through means such as viruses, which can bind to the cancer cells, be taken up by the cancer cells, deliver their cargo to the cancer cell, and then alter the way the cancer cell works. The gene that we're using at the University of Pennsylvania now is a multifunction gene. When I say multifunction, means that when we put that gene into a cancer cell, it will have multiple beneficial functions for the patient and negative functions for the cancer cell. So we are using a gene called interferon alpha, and this gene shuts down the tumor growth, decreases tumor survival, it decreases the blood supply to the tumor, and perhaps most importantly, it activates your body's immune system to help fight the cancer. All of these come together to cause the death of the tumor. What's remarkable about both the experiments we've done in animals and the trials we're doing in patients currently at the University of Pennsylvania is that we call this inject locally, act globally. So I showed you that picture of that chest cavity of a patient with mesothelioma. That space, that pleural space that's remaining, can often be quite small. But what we've shown is that we only need to get the gene into a small portion of that chest cavity. That if we can alter the genes of a small number of the cancer cells, that we can then generate a response in the immune system that we multiplied manifold that will attack cancer cells throughout the body. So this is a PET scan. For those of you who've never seen a PET scan, it's a combination of a structural imaging. You heard Dr. Harba talk about a CAT scan, which looks at the structure of the body, and a mechanism by looking at the activity of the cell to get an idea about how concerning or not concerning the structures are. So what you see on the left-hand panel is a PET scan of a patient with mesothelioma who had been through surgery, radiation therapy, and chemotherapy and had recurred. And every white spot that you see in the top upper and lower panels on the left-hand side is an area of recurrence of the mesothelioma. Generally, when a patient has been through that extensive treatment, has recurred, the survival of that patient will be measured in the matter of months. This patient received a single dose of our interferon gene therapy with no other treatment. And the scan 6 months later shows that almost every white spot was gone. That we had generated an immune response that did not previously exist, that was able to, by itself, with no chemotherapy, no radiation therapy, no surgical resection beyond that initial treatment, to regress the tumor. This patient lived another 2 years and died of progression of his disease. So we don't have the cure. But I think that we are on to something, which is that we have the capacity to harness relatively non-toxic mechanisms within our own bodies to fight the cancer. This is another patient from our trial. This is from 2 years ago. This is a year after receiving gene therapy. This is a patient from England who had received chemotherapy in his hometown of Portsmouth, England. He had been exposed in the construction trade and was a sailor and was unable to sail because of the progression of his disease. And came to us because in England there was nothing else to offer after his chemotherapy. He went through gene therapy at the University of Pennsylvania, then went on to resect some of his tumor in London, and still to this day, 2 years later, he's sailing in races around the southern part of England. What's most interesting, as I mentioned, is the combination of treatments for mesothelioma using experimental therapy with standard approaches. Now, this is a little bit of a complicated slide, but let me walk you through it because it's important. This is a mouse with mesothelioma. a mouse with an intact immune system. The first bar you see is the control, which is if we inject the mouse with mesothelioma cells, how much tumor would grow without treatment. The next panel is the reduction in tumor that you would get from the best available chemotherapy that we have to offer, Alimta or Pemetrexed and cisplatin. On the third panel is just our gene therapy alone, with no chemotherapy and no other treatment. The fourth and the fifth panels show you the combination of chemotherapy and gene therapy together. We have spent many years at Penn looking at how these combinations work and how best to juxtapose these treatments to make them work better. We have currently a clinical trial, and this is again a complicated slide for which I apologize, but really important. This is our current study, and it has 3 parts to it that you need to know. And again, this is the second slide that I would ask you to remember, because this is the 3-arm trial. The first arm is in the red, which is a high dose of a drug called Celebrex. This drug is a drug which basically releases the ability of the body to help fight the cancer within the cancer. In the blue are the 2 doses of the gene therapy that we give. And lastly is the chemotherapy. And let me just show you this slide, which shows you the promise in patients of this trial. So on the top panel and on the bottom panel are patients pre and post. What you see in the circle on the left and on the right are the pre and the post combinations. And this shows dramatic reductions in tumor. The results are preliminary. So far, in the combinations of patients who've received both chemotherapy and gene therapy as frontline treatment, as their first treatment, we have a response rate of over 66%. Now, the numbers are small. We have no control group. But compared to historical controls of response rates of 40%, we're very excited about where this combination is headed and look forward to additional presentations of our data at conferences going forward. I'm going to skip through the next slides because of the time limits. But I want to show you this. This is not mesothelioma. This is melanoma. This is a skin cancer. This is a trial at the National Cancer Institute of a trial using an ability to harvest our own white blood cells to modify them and reinfuse them into a patient. What you see here is a lymph node on the right-hand side of a patient with melanoma, skin cancer, which is refractory to all treatments. And what you see on the right-hand side is 12 days later, after an infusion of these white blood cells that had been targeted against melanoma, a dramatic, almost complete response with just an immune-based treatment. At Penn, we were the first group in the world to do this for mesothelioma. And this is our patient who agreed to allow me to show his picture. This was last fall, and we continue to do this trial at Penn, which we think is an extremely exciting trial, harnessing the ability of our own white blood cells to fight cancer and to fight mesothelioma. At Penn, I'm a very small part of a very wonderful program. Aspects of thoracic surgery, medical oncology, thoracic oncology, pulmonary medicine, multiple laboratories, psychiatry. We have here in our audience today our patient navigator and associate director of operations, Karen Mudrick, who has really lent a tremendous benefit to all of our patients. And I owe her a debt of gratitude for all she's done for our program. But we are also just one program around the country and the world that is trying to fight this disease. And I look forward to continue to work with you to try to find a cure in the future. Thank you very much.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.
Your heart